Hi, everyone. Welcome back to another episode of Every Month Med. This month, we wanted to focus on mental health in teenagers. Today, we have a very special guest, Dr. Nayak. Dr. Nayak is a psychologist here in New Jersey who specializes in patients experiencing challenging medical and life experiences. Dr. Nayak also treats patients with depression, anxiety, and has advanced training in cognitive behavioral psychotherapy. Without further ado, welcome Dr. Nayak.
Thank you so much for being here.
Thank you. I'm happy to be here and I'm happy to chat with you guys.
All right, so we're going to get to a couple of questions. So our first question is, can you tell us a little bit more about your background and what you do?
Sure. I think Mega's already given you some background, but to add to that, like Mega said, I am a licensed psychologist. I graduated from Stony Brook University with a PhD in clinical psychology. But from the very beginning, my interest has always been in the area of health, meaning medical illness, and looking at the overlap of medical illness and psychological health or psychological difficulties. So for the first decade of my career after my PhD, I spent a lot of time on doing research in the area of depression and chronic pain. And since 2006, I have been in private practice. My practice is largely focused on chronic illness and chronic pain. I work largely with adults, but there's a number of teens in my practice too, oftentimes coping with some sort of chronic medical condition like migraines, chronic pain, concussions, and many other illnesses along that realm. But oftentimes I'm just seeing them for the treatment of depression or anxiety, sometimes trauma. So I have a special interest in working with people with chronic illness, but in the last few years have been focusing a lot on trauma too, because sometimes even dealing with chronic illnesses can cause trauma, or trauma can lead to chronic conditions. For example, I oftentimes see in my practice people who've been in car accidents, for example, and that has created trauma, or it could be an accident at work, or in some of my teens, it's a sports accident in school that maybe a fall, a football accident that then resulted in a concussion that then caused pain. And then they end up in my practice because you're struggling with it or struggling to adjust to it and cope with it, or the pain or illness has had a negative impact on their life. And because of that, they need help with their adjustment. So that's a little bit about the work I do.
Yeah. I can totally relate to it because my brother had a freak accident in the gym a couple of months ago. So and it caused a whole visit to the ER and a surgery to his nose, fractured skull. So I've seen the way it affects him, and it's affected him mentally, like getting back to school and getting back in the rhythm. It's affected him a lot. So I totally see. Yeah.
Sure. Yeah.
Yeah. And I feel like it's really interesting to see how physical injury links to mental health. And I feel like a lot of people maybe don't see that. I feel like when I was very young, wouldn't have been something I would have been able to see. But I feel like especially as you get older, you kind of connect physical and mental health, and they become really intertwined, and they're both extremely important.
100%. And I think it's not just because it's stressful, but a lot of times that, it's a ripple effect. I think of it as ripple effect. Like when you deal with stress, it's not just that because you have stress, it's upsetting in terms of your mood or anxiety, but a lot of times when you're dealing with stress over a prolonged period, and we can all relate to that because the last year and a half has kind of been very bizarre for all of us.
Yeah.
It actually changes your biology. So chronic stress rewires you neurologically. It's causing your body to secrete more stress hormones. And when that happens, if it's for short bursts, it's okay. But if it's prolonged, then what that does is it causes all kinds of secondary problems. That's why stress-related illnesses are so high. I mean, stress is the #1 killer in the country today. Because a lot of, and I'm talking about adults here, where heart disease, liver problems, all of them can result from chronic stress because it changes the way our body reacts and changes the way our body can adapt. So higher levels of cortisol and adrenaline in our blood can then cause multiple changes in our body. You know, it affects our cardiac functioning, it affects our gastrointestinal functioning, it causes more muscle tension, more pain. So it's sort of a ripple effect that we have to make sure we pay attention to someone, especially a teenager, you know, if let's say they have illnesses, but even otherwise chronic stress, you want to kind of address it early on so that it doesn't turn into a bigger problem.
Yeah, I think that's really interesting how you said it kind of goes both ways in the sense that like physical pain can cause mental health issues, but mental health issues can also cause physical stress and duress on someone's body,
Sure.
which I didn't really realize, I guess, until now, as well. So our first question or second question that we have for you is, what do you find to be a main source of stress in teens and adolescents?
Well, before the pandemic, I think teens and adolescents had plenty of stressors, even without having to deal with the challenges the pandemic produced. So I'm sure you're familiar with this being a teenager, but worrying about schoolwork and grades, I'm sure, is the number one stressor because the pressures keep increasing. And as you go through high school, it's a lot of pressure. As you get into college, there's pressures there too, because the nature of the work you have to do changes. Juggling responsibilities like balancing work with extracurricular activities, sports, time with your friends. So that puts pressure because there's only so many hours in the day. Having problems with friends and peers, like bullying, peer pressure, feeling like you have to say yes when you want to say no. Feeling pressure to become sexually active when you're not feeling ready to do that, you know, or a boyfriend who's putting pressure on you to have sex when you're not ready to do that. That can add to your stress. Um, Other life transitions, like maybe changing schools or moving houses during your high school years, that can be extremely stressful. In fact, there was one stress survey done by the Psychological Association that said um, the number one stress, even higher than the death of a loved one, was moving.
Wow.
Because you're relocating. Think about how comfortable you get in your environment when you're going to school. You know the people there, you know your neighborhood, you live in the same home, you know the lay of your town, so you know exactly where to go to which store and where your hangout places are, where the library is. And then when you pick up and move to a different town, now you have to start over and you have to make new connections and you have to get familiar with a new town and figure out where to go and what to do and get familiar with new people, new teachers, new environment. It can be very, very stressful. So moving and then for some teenagers, maybe not so much in our community, but in other communities, dealing with homelessness, dealing with lack of economic resources. So they may have to work after school to help the family out because they don't have, you know, funds to support the family. So they may have to pitch in. Um, Dealing with housing problems, not enough room. I mean, you know, we take these things for granted, but it's a huge source of stress for a number of teenagers in our inner cities where we all have the luxury now of being in our own rooms doing Zoom calls for class.
Yeah.
But some people are 5 people in an apartment.
Yeah.
And if you're a teenager in that setting, how do you adjust? Having poor self-worth, a body image difficulties where you don't feel good about yourself. And that may come from some of the other problems, but it can also be a problem in its own right. You know, not being satisfied with the body, concern about their weight, or any other image related issues can be a huge source of stress. Also, remember, this is an age and a stage in your life too when you're going through a lot of changes.
Yeah.
So puberty can cause changes, and that can sometimes make people very uncomfortable in their own bodies, and adjusting to the changes can be a big problem. Seeing parents go through divorce or separation is a huge source of stress, and a number of our teens are dealing with that. Living in an unsafe home or neighborhood can cause some of that. Figuring out what to do after high school, it's a huge source of stress for a lot of some teenagers know exactly what they want to do, but a lot of them don't, and they struggle with the direction of their life, what they want to do. The whole process of getting into college.
Yeah, that I've seen
I can
everyone go
relate.
Yes, I'm
We're
sure
not
you
even
both can
seniors.
relate. And it's not easy because it's a lot. It's a lot to do. It's many steps. And it's at a time too when you are going through your normal school year, trying to keep up with schoolwork. You're also trying to go through the process of college applications and standardized testing, interviews, visits, college visits. And then we come to the present day, which now you have to do that in a pandemic, where you're more limited, you're socially isolated. And on top of that, your social support systems are not what they used to be, because you can't connect with people the way you used to. You can't walk into your counselor's office and just talk to them about college stuff, or go to a teacher after school, because everything is now virtual, or at least mostly virtual. I know schools are coming back to in-person meetings, but for a lot of people who are doing that, it's a big source of stress not having social connection.
Yeah,
I
I
think.
can.
Oh, go ahead. Sorry.
No, I can just definitely relate to like the moving part, because I moved schools my end of freshman year, and I'd been at my old school for 4 years. I went through middle school there, and just the stress of having to find new friends, find a social circle, even like some simple things like finding people to eat with, like it was just so stressful, and it put me through like a stage of like I don't eat lunch at school, and like it was just a hard time. And I can't imagine like moving towns and moving schools at the same time. That's got to be difficult for a lot of kids.
Sure. Yeah.
Yeah, and I feel like it's so important, and I didn't realize that like stress can be sourced from so many different areas. Like it doesn't have to necessarily be concentrated or coming from one specific area like academics, but it could also be coming from like social life and, like you said, housing and like life at home. And I think it's important to realize that like stress can come from so many different places, and it can really, all those different like sectors of your life can really contribute to how you think and your mental health. And I think it was really interesting to hear about that.
Yeah. So our next question is, how have you found the pandemic to affect the levels of stress?
Significantly so. It's been very concerning to see the impact that the pandemic has had on teenagers and adolescents, especially because of the stage of life that you're in. Because if you think about it developmentally, adolescents and teenagers are at the point where part of your sort of development of personality and identity is separating. When you're a young child, the attachment that you have with your family and parents is what helps you become the person that you are. But as you become an adolescent and teen, I think it's part of normal and healthy development to start to create your own identity and step away and spend more time with friends, and go out more and spend time away from the family. And so what the pandemic has done is it's artificially shut that down and pulled people back into the home, which is tough on teenagers, especially because of the social isolation. Social connectedness is very protective for our mental health. There's something very therapeutic about, social contact. And I don't just necessarily mean, going to a party with a friend, or, hanging out with your friends and doing something fun, or watching a movie, or playing a game. It could be even just small gestures of chatting with your neighbor over the fence. It could be things like going to a book club, or going to your sports practice on a regular basis, or going to an after school club. All of those things have really good mental health benefits for us, because it's something about feeling like you're part of something, a part of a group, maybe some volunteer organizations that you used to be part of. And what happened last year is a lot of that got shut down. And so what that did is it stripped away the ability for us to stay connected to people. Certainly you had your families, but the more we have variety in our social connectedness, the more supportive it is, and the more uplifting it is, and it helps our mood. So yes, in addition to a lot of the stress we've talked about in terms of just the demands on a teenager's life in terms of schoolwork, grades, sports, band rehearsals, weekends filled with social stuff with friends and family, now it's added another layer of stress, which not only includes social isolation, but also fear and uncertainty. Like, when is schools going to open again? Like, what's going to happen with college admissions? Or and now fear of getting sick as well, which is, I think, a real fear for teens. And if they did get sick, let's say they did get COVID, then the the pressures and stress brought on by having to quarantine, being isolated even more, and sometimes in some teenagers, the stigma of what does that mean? Are people going to think that I'm not being careful or I'm not being safe? So, depending on the individual, all of these little situations can be stressful in many different ways at many different levels. But last year, I think what's important to observe, and I saw this in my practice to some degree with some of the teens and young adults I was working with, was also the other element that came into play, which was the social and racial turmoil we saw happening in our
Yeah.
country. A lot of the racial turmoil was very stressful. I mean, it affected people in different ways, certainly, just like it did adults as well. But I think for some teens, it was stressful. It was very concerning about where this world was going and what kind of life they have, if this is the kind of divisiveness they were seeing around them. But it also mobilized and motivated some teenagers, and they started attending rallies or becoming part of Facebook groups where they could talk about diversity. And so some people use that information to motivate them to become involved and become socially connected, even if it was virtually or going to an outdoor rally. But for other people, it was very scary.
Yeah.
And of course, the political climate last year was also very tough.
Yeah.
So that was, and also I guess there was divisiveness there too, because sometimes teenagers, have strong opinions of their own, but they're also absorbing a lot of the home conversation in terms of where they land politically, and if it doesn't agree with people in their peer group, then it was causing a lot of conflict between friends. So that was another layer of stress. So I think the past year presented its own unique challenges on top of the typical challenges. And because of that, we've seen in the past year a sharp rise in the rates of depression
Mhm.
and anxiety, both in, teenagers and even younger adolescents. But interestingly, it's been more so among girls than boys, but there's been a significant increase in boys as well. Um, so there's been some interesting statistics, but in addition to that, there's also been we've seen an increase in other behavior problems like eating disorders, sleep problems. Um, a survey done of parents found that they noticed their children withdrawing even from the parents, becoming more quiet, more isolated, not being connected even within the family, more aggressive behavior, more so than usual. So the behavior problems were less of an increase, but depression and anxiety was the biggest impact we noticed.
Yeah. I know you mentioned like a little bit of like social connection, human like connection. Did you find that when you went, if you went virtual for your practice, did you find that it affected the way you were dealing with patients as well?
It's interesting that you asked that question, because I think just like with the dichotomy I've been talking about how different people are reacting differently, I saw the same with the practice, that I think for some people, they liked it because it gave them easier access to care.
Yeah.
That's interesting.
And especially as I mentioned earlier, since I work with a lot of individuals that have chronic illnesses of some kind, this makes it easier for them. They don't have to get in a car, drive someplace, walk from the parking lot to my office, because they're already dealing with a medical illness. They can be in the comfort of their own home and talk to me still. So I think the plus side has been is it's given people more access to care and access to care when they didn't have it before. So now I'm able to see people further out in the state in South Jersey, even though I'm up in North Jersey.
Mhm.
And that's great. I couldn't do that before, because now, rules have been relaxed and people can see their therapists over, a telehealth portal, which is fabulous because it allows access to care. The downside is, yes, you miss some of that interpersonal connection. There's something about seeing a person in person, the human contact piece that's missing. And so that part is missing too. But some people don't like to come into the office and have to wear a mask.
Mhm.
And for me as a psychologist, I like to see people's facial expressions, because I think 80% of our behavior is nonverbal, and we miss so much when we cover our faces.
Yeah.
So so there's some of that that's lost. So it's a mixed bag. For some people, they like to come in. For other people, they're quite happy doing this because it gives them access.
Yeah, that's
That's really
really interesting.
interesting. do you feel, just kind of to touch a little bit more on the like technological side, do you feel that when you were consulting with patients over Zoom, it was like harder to read body language as like part of your like routine when checking in on them?
100%. Yeah. And, when I always say to my patients, my evaluation of them starts in the waiting room because I'm watching how they walk in, and
Yeah.
also because of my specialization. Uh, but even outside of that, if someone's depressed, you can see it in their body language. They're slumped over. How are they making eye contact? Are they looking at? Are they smiling enough? They're not. Are they interacting with my front desk staff? Because some people make small talk, some people chat and laugh about stuff.
Right.
Some of my patients who have chronic illnesses, I can see, if they're limping, if they're hunched over, has their posture changed? Are they using a cane? Are they not using a cane? Are they using their walker today, or are they walking without their walker? So those give me clues. And if I'm sitting in front of a screen and they're sitting in front of the screen, I'm not seeing that.
Yeah.
I'm missing out on that piece. So definitely body language is important. And that piece is missing. But I ask them questions about it. And sometimes they'll get up and walk for me, so I can see it on the screen. But yeah, there's definitely pluses and minuses both ways.
Yeah. Our next question is, what role has technology played in teen stress, and does it make a difference what type of media is consumed?
This is interesting that you raised this question, because I think there's very polar opinions both ways. Like, is there good coming out of this, and is there bad coming out of this? And even media consumption or technology consumption can be active or passive. Active meaning it's someone who's actively involved in, let's say, texting somebody else or posting, or throwing pictures out there for people to look at. And passive is just, people who are sort of more silent observers, who are probably just checking what other people are doing and not actively involved in maybe sharing content. Regardless of that, a lot of research has been going on over the last 3 decades, I'd say, in terms of, looking at the role that technology plays and how it affects, teen mental health. And the answer is neutral, meaning it's not particularly positive, it's not particularly negative. Some studies have shown more of a negative slant, but it's not powerful enough that that I'm compelled to say it's not a good thing for teens. I think when we look at studies and research, usually what it's doing is it's consolidating the group and saying, okay, overall, this is what we're finding.
Yeah.
But there's always individual differences, and there's always outliers. So I really think it depends on the individual. For some individuals and for some teens, social media and technology can provide, especially social media and social networking can provide a very beneficial effect. And that is connecting with people, especially during the pandemic, connecting with people, feeling like they belong to a group. So even if they don't feel, let's say they feel isolated in their school or their class because they haven't found a group of people they can be friends with, but they can still go out there, and it opens up their world because they can connect with other people out there. And so that can be helpful because they can find their people and find people they identify with and share with and feel comfortable with and feel accepted. They can also find people who have common interests, joining groups and clubs. And I have come across teens who also love that, if they're struggling with something, let's say I have an eating disorder, there are eating disorder groups out there, and I can talk to other people who are going through what I'm going through. So now I can connect with them. So there are little benefits like that that are great, if it's a healthy connection.
Right.
And that's important, and likewise, it can also have its negative impacts. There's a lot of online bullying, as you're well aware, among teenagers and adolescents. So sometimes people, in their effort to want to belong to a group, can get picked on, can get bullied, can feel put down, and that can come with its own set of challenges in terms of mental health and stress levels, which is unfortunate. Um, but I think one of the findings that came from looking at a lot of studies on technology and teen mental health is it's not so much, okay, is it good or bad? It's more about the dosing, so
Right.
that too much exposure to it can be problematic, but in moderate levels, it's not detrimental.
Right. Yeah.
I feel like that's definitely something I could relate to. Like, I feel like before the pandemic, we obviously use screens a lot less. And then that transition to the pandemic, now like school's online, a lot of activities are online. And like to see the difference of kind of even like my tiredness levels, like before the pandemic, I wasn't looking at screens. I wasn't getting as tired from like looking at screens. But then definitely the transition, I feel like staring at a screen all day, sometimes my eyes would hurt or even I get headaches. And I think that transition really affected that.
Yeah.
Absolutely. And I think that, so that's an interesting other issue that you're raising, Mega, which is about, how much screen time
Yeah.
people are engaging in right now, because, and you can't help it because you have to um, spend time in front of the screen, not just for schoolwork, but also then afterwards homework. And then, if you want to relax and connect with friends, you're back in front of a screen.
Screen.
So it's a lot more screen time than I think any of us has been used to. And interestingly, there's been some speculation that it could be related to all the sleep problems we're seeing, because this past year we saw a spike in sleep difficulties. And one of the things we do know is that exposure to LED light, which all of our screens have,
Yeah.
causes more sleep problems because it
Right.
really activates your brain, meaning it stimulates your brain. So your brain doesn't kind of quiet down and settle down when you need to go to bed at night. So that can produce problems. So it's interesting that we have an issue here, or a situation here where we really can't control the amount. But what I would suggest is taking frequent breaks. Where
Yeah.
you kind of
That's
shift
important.
away from a screen and take breaks, like even between classes or between class and homework time, or between homework and playtime, just sort of get away from a screen and do something active. It's like allowing your eyes to sort of shift so that your focal length, it keeps moving. And I heard this little rule of thumb one. Apparently, and I don't quote me on this, but in the technology world, it's kind of sort of like a little algorithm that's used, like 20 thing. Every 20 minutes, take 20 seconds and look 20 feet away.
Oh, that's interesting.
Yeah. So it's just to let your eyes relax. So because otherwise your muscles are kind of contracted and focused on one point for a long period of time. That can be
Yeah.
tiring on your eyes, can cause, you were talking about headaches, and it can contribute to headaches. So if you keep shifting your focus, or if your desk is close to a window, look out the window for a little while,
Yeah.
walk around, get outside and look at other things so you're not staring at the screen continuously.
Yeah. And I feel like that social aspects you were talking about, like FaceTiming with friends, I've noticed my screen time on FaceTime has gone up like exponentially since the pandemic
Ew.
started. And it's just like my friends and I were talking the other day how we just literally were on FaceTime and we're doing our own work, but we're just on FaceTime because we crave that social
Yeah.
interaction that it provides, like just
Sure.
talking to someone while doing work, listening to music while doing work. And it's just so interesting to see like how it like all plays out.
Yeah.
Yeah. And I feel like adding to Ishan's point, it's like, even if we're not talking, just like knowing someone is there,
Yeah.
like that makes you feel like you're just like not alone in your room. And I feel like that definitely is a beneficial aspect of technology regarding social interaction.
Absolutely.
Yeah.
And I think it goes back to the power of social connection. I would encourage you to read um, an author by the name of Richard Putnam. And I'm just sort of, um, you know, trying to, I'll share some resources with you. But nevertheless, Dr. Putnam is a professor at Harvard, and he has done a lot of research on the benefits of social connection and the health benefits of social connection. So he's not just talking about feeling good about, connecting with other people, which you're talking about it. And it's one thing to hear their voice, but it's so nice to actually see them on a screen. Even better to be with them in person. But if you can't be with them in person, we crave that social connection. But there are reasons why, because, people who have connections, and it's not just the quantity of connections, not like how many friends you have or how many people you know, it's just the quality of connections to who you feel comfortable with, and and feel like you can communicate with well. It's associated with health benefits. Again, these people are happier people, they have less depression, they have lower blood pressure, they have less heart problems because of the comfort and the support it provides them.
Yeah, that's really interesting. We'll definitely look into that author and maybe provide some links about what he writes about. So we wanted to transition a little bit and talk about your specialty. So in your specialization with working with patients who experience injuries and hard situations, how has mental health been affected in kids with medical conditions?
Sure. Now, mental illness by itself, like looking at healthy teenagers, meaning teenagers who don't have any medical challenges or medical illnesses, mental illness is already increasingly common among teenagers. I mean, depression and anxiety rates, as I was telling you, like 1 in 5 teens between the ages of 12 and 15 suffer from at least one diagnosable mental health disorder, which is kind of high.
Yeah.
But when you throw in a chronic medical illness on top of that, those rates jump even further, because having a chronic illness adds to the level of stress that a teenager already. I mean, we talked a little bit about all the stressors that teens encounter in their daily lives, and so now throwing in a chronic illness adds many layers of stressors on top of that. So, there's a rising trend in teens who are seeking mental health treatment, the epidemic, but now we have found that, teens who have chronic illnesses of some kind, have a significant, and the reasons for this are because it produces challenges. When you're living with a chronic illness, it produces a whole lot of challenges that can disrupt your school life. A child may miss periods of school because they have to go to doctor's appointments, or because they don't feel well enough to come to school consistently, so they're missing school, or they don't feel well enough, so they can't focus, so they have to take prolonged periods of times because maybe they need to be hospitalized, they have to go undergo surgery, or they have to go for physical therapy. So there's a lot of disruption there in their school work, school attendance. It can also disrupt their friendships. Maybe they can't go to all the gatherings or go hang out on a Friday night with their friends like they would have liked to because they're not well, or they have to get treatment, or it's just they wake up and they're having a bad day, and their body just doesn't feel right, or they're in a lot of pain, or they're dizzy. Depending on what the medical condition is, if their bodies don't feel right, they can't participate in a lot of the social activities that a healthy teen can. They miss out on a lot of the extracurricular activities, so it disrupts their extracurricular activity. So even though they may have an interest in something, maybe they can't do it. So I was talking to you about injuries earlier. For someone who loves football, say, and it was on the football team, and now if I fall and I've developed a concussion and I have chronic headaches from it, and I can't play anymore, that's really disruptive, because maybe that's part of their identity. That's part of their social connection, being with their team and participating, and it can be very disruptive and upsetting. And also, it disrupts their emotional and psychological development. If, for example, the illness develops earlier on, like early adolescence or even in childhood, and then it plays out through the teen years, it can slow development down, whether it's physically or emotionally. It can disrupt even their normal course of development. Depending on the illness, it could delay puberty or cause disruption in the development of their body. And so, it can disrupt their functioning at many different levels. And so, yes, it adds a layer of stress. But if we think about mental health and mental illness among, you know, in teens in general, it's about, I would say, about 10 to 15% of teenagers. But then when you add in a chronic illness, it jumps up to about 30%. You know, it goes up quite a bit where they are dealing with depression. And, you know, and when we're talking about chronic illness, it's everything, you know, from like kids, teens who have asthma, who have musculoskeletal problems, who have juvenile diabetes. We're talking about, you know, some people have skin problems, some have attention deficit, some people have cerebral palsy on the most severe end, but it's any number of issues that a lot of teens, in my practice, I work with teens who have chronic pain, either from migraines, or from injuries, or from concussions, or from, you know, different kinds of difficulties, you know, or some neurological problem that's causing pain. So it can be very, very disruptive and depressing, because you can't have a normal routine.
Yeah.
You know, you can't, and you can't plan so much. You may plan something on Saturday, but if you wake up and you're in a tremendous amount of pain, then you can't do what you had planned to do. So it can be very disruptive. But because of that, we see higher rates of depression, higher rates of anxiety, and higher rates of other behavior problems as well.
Yeah, I think it's really interesting how you mentioned like with these injuries and chronic illnesses, you kind of lose a part of your identity. And I think that's so, and like, it's just really hard for a person to go through that and lose some like part of what they are as a person. Like, it's got to be very difficult.
Sure.
Yeah, and I feel like it's interesting also how you mentioned it can kind of consume so many different aspects of your life, like your social life and academic life and other things that you may not like realize, but it actually really can contribute to kind of limiting a person and in how they act and how they behave.
Right.
Yeah. So our last question is, what tips do you have for teens to cope with stress?
Oh, there's plenty everyone can do to take care of themselves. And I think it's important to understand that, you know, and my a quote I love is that stress is inevitable. You can't help the stress. This is part of the stage of life that you're in, unfortunately or fortunately. You know, when
Yeah.
you're a teenager, you have to go through the pressures of academic work and sports and extracurricular, and now the pandemic and the challenges it presents for us in the social isolation. But distress. So stress is inevitable, but distress is optional, meaning how upset you get about it is optional, because if you take good care of yourself and pay attention just as much to your mental health as you do to your physical health, I think you can find yourself in a good place regardless. Are you going to have moments? Of course, because that's human and that's normal, but I think it's important not to let it turn into something that's more persistent and chronic, because that's when it's more damaging. So, what are some things you can do? The first thing I would encourage all teens to do is take care of your body. Start with your body. I don't think we focus enough of our body. We focus on the person inside the body, and we indulge that person a lot. But it's so important to think about, what does my body need? So let me give you an example. So um, let's say for a person who's trying to watch their weight, right? Like it's so tempting because there's this huge piece of cake in front of you, and you really love the taste of carrot cake, and that carrot cake is kind of got your name written all over it. You're trying to lose the weight, so you know you shouldn't eat it, but because it's so tempting and you love it, you just go ahead and eat it. And so what that's what I mean by the distinction between indulging the person in you versus taking care of your body, because I think a lot of the times we're just so focused on the gratification. I like the taste of it. Does my body need it? No, it doesn't. Maybe a bite would have been enough. I don't need the whole sliver of cake. But we kind of indulge ourselves, like the person inside of us, and what that person likes and dislikes, but we're not focused on, does my physical body, meaning my muscles, my organs, my blood, my circulatory system, my neurological system, does it need that? Like, is this good fuel for it? Because so essentially, coming back to how to cope with stress, it's like, take good care of your body by making sure you eat good nutritious food. Of course, once in a while, indulge in your pizza and fries and all the yummy food that we like, but you don't want to do that all the time or frequently,
Right.
because your body is not going to do well with that over time. And with stress, like I talked about, with the two-way relationship between stress and physical health, it's so important to consider that you want to really think of your body as what's holding you up, and if you don't take care of it, it's not going to take care of you.
Right.
And so what you want to make sure you're doing is putting good fuel in there. Of course, once in a while, treat yourself, like maybe once a week, indulge. But for the most part, especially on days where your work is intensive, where you have a lot of school work and you have to, you're attending classes, you want to make sure your brain's sharp. And if you want your focus and your concentration and your energy level to be good, then make sure you're putting good fuel in that body, and you're hydrating well and you're sleeping well. I can't emphasize sleep enough. Sleep is so important. Sleep is the foundation on which the house is built. If your foundation is not strong, everything else is going to collapse.
I like that.
So if I think sleep is critical, and it's not just about quantity, it's about quality. So you want to get good quality sleep. And at your age, as a teenager, you need a good 8 to 10 hours of sleep. I know that seems near impossible with the amount of work you have, but do the best you can to be protective of your sleep. Try to get to bed at the same time every night, wake up at the same time every day if you can help it. Avoid interruptions. Like, don't look at your phone or screens so close to bedtime. Give yourself a buffer, maybe for an hour before bed. Like, shut off all screens, listen to music instead, or read a book, you know, um, so that you can give your eyes a break, since you've been exposed to screens so much. And that'll improve the quality of your sleep. Make sure you're getting good exercise during the day, gets a lot of activity, so your body's tired enough so you'll sleep better.
Right.
There's a relationship between the level of physical exertion and quality of sleep.
Yeah.
So, and it reduces stress levels too, because the better you sleep, the more replenished you feel, the more energetic you feel, and your mood is in a better place.
Definitely.
So it's all connected. Along the same lines, try to reduce your intake of caffeine. There's nothing wrong with a cup of coffee,
I
wake
can
up in
work
the
on
morning. But making sure you're not drinking coffee through the day, because one, it's very stimulating. Two, it disrupts your sleep at night.
Yeah.
So of course, your cup of coffee in the morning is fine, but as long as it's not too much consumption. But also, what caffeine does is it feeds the sense of agitation and anxiety, and you don't
For
want that.
sure.
Like, you
Yeah.
want to feel calmer and more, sort of in balance. You want to stay away from too much caffeine, avoiding illegal drugs, tobacco, vaping, weed. You just have more control over your cognitive functioning if you're feeling more clear and more focused. Um, Another good technique, again, this is to take care of your body, but also to take care of your mind, is using relaxation techniques. And that includes everything from just simple deep breathing, all the way to meditation, to doing some kind of mindfulness exercise, or incorporating it into your, exercise practice, like yoga or, Pilates or something like that, where there is some component of relaxation included in the practice. But I think it's critical. Why? Again, it goes back to the physiological benefits of it. Relaxation techniques help you calm down the physiology. It calms down the part of the brain that is activated by stress, and it triggers the parasympathetic nervous system, which is your relaxation response. So we have control over this, and it's so easy. All we have to do is just practice and consistently do this. And there's plenty of apps out there, like the Mindfulness Coach is one of them, Calm is one of them. There are plenty of apps out there that teach you these exercises, and I'm happy to share some of those resources with you. But it's important, even if it's 5 to 10 minutes a day before you start your school day, just doing some deep breathing, or between classes or during your lunch break, doing something to relax your body and your mind can make a huge difference in the long term. Um, Developing assertiveness skills, by that I mean being able to say no when you want to say no, instead of committing to everything and then feeling like you're stretched and pulled in different directions, right? Really picking and choosing what you want to get involved with, and picking the things that you're going to enjoy and find fulfilling, but not feeling like you're overscheduled, and then not being able to give it your all. So I think that's an important skill for dealing with stress, learning practical coping skills. And by that, I mean, it's how you approach your work. If you feel like work is a lot, then setting realistic small goals for yourself every day, not over planning, so that like if you plan to do 10 things in a day and you only have time for 3, it's going to be very frustrating and very stressful. So always create a to-do list for the day and cut it down by about 50% because that's realistic.
Yeah.
And not kind of expecting perfectionism, like not being perfection and being okay with good is our it's fine. So it's like lowering the bar sometimes and not putting a lot of pressure on yourself is important. And in order to do that, one of the important skills is also to decrease negative self-talk, like not being hard on yourself. I think, it's important to realize that you are your best cheerleader. So if you got to be kinder to yourself and be a little bit more accepting of, okay, this is all I can handle, or this is the best I can do for now, and that's good enough. It doesn't have to be perfect. Being able to say that, but also recognizing that, this is tough for me and I need to take care of myself. I need a break. I need to do this so that, so it's just being more self-aware and recognizing when you're having a hard time. And reaching out to people to talk about it too. Like if you're really struggling with something, whether it's academic help or it's just that emotionally I'm not in a good place. Talking to a parent, talking to another adult you trust, maybe a coach or a teacher, or a friend, and seeing, if that helps you. And if not, reaching out for professional help. What else? Distraction is a powerful tool for coping with stress, and that means pleasant distractions. And if that's something like, just going out with a friend, listening to music, drawing, doing something artistic, writing about it. Sometimes writing about your stress can be very helpful too. And there's been a lot of research on this, that people who write about their stress, especially students who write about their stress, even if nobody reads it, and it's just you journaling about it and putting it away, just the act of organizing your thoughts, putting it on paper and putting it away can reduce stress levels.
Yeah.
There was an interesting study done by a Dr. Penny Baker who found that students who wrote about their stress actually got better grades.
Oh, interesting.
Yeah. Even if it's stress about, oh, I have an exam coming and I'm feeling nervous about it, but just writing about what emotions you're feeling, what is stressful, why you're concerned, what your fears are, can be very helpful. So writing about it, talking about it with someone can be very helpful to reducing your stress levels. And use your network, social network. It's so important to do that, to reach out to people and talk about it. Some people are very private and shy, but it doesn't hurt to, reach out to someone you trust to talk about how hard of a time you're having. And if you feel like this is not something just your friends can help you with, then don't be afraid to ask for help, because there's a lot of resources out there that can be very helpful, and so important to reach out for help.
I think the way you touched up on like taking care of our bodies is like something I never thought about before, because I always thought of like, oh, it's just one piece of cake, I can like treat myself, and then that turned into like the next day a bag of popcorn or like pizza. And I felt like that was helping me, but I think taking care of your body is more important, because if you're feeling good in your body, you're going to feel good mentally. And I think that's something that's that's looked upon, and it's like people don't recognize it. And I think it's something that needs to be recognized.
Ishan, what I would also say to you is like, there's a couple of things that when I chat with my patients, I say to them, it's like, think of your body as a car. What do you have your car for? Your car is just a vehicle. It takes you from point A to point B.
Yeah.
Our bodies are no different. It's our vehicle. It takes us from birth to death.
Right.
So if you don't take good care of this car, it's not going to get you to, it's going to start falling apart.
Yeah.
And with your car, you take good care of it. You take it for your oil change, you get it tuned up, you get it repaired, you get it cleaned up. Our bodies are no different. So when you put food in your body, you have to think about, how does it make me feel good? It's supposed to be fuel. So you're supposed to feel good after you eat food,
Right.
not sluggish and like you want to pass out.
Yeah.
So if food is doing that to you, then it's not working right. There's something not right with it. Same with hydrating. I mean, we sometimes forget to hydrate because we get caught up but you actually feel better when you're well hydrated.
Yeah.
Sometimes the stress and the pressure you feel in your head of sitting in front of a screen for so long, it's just even hydrating enough, will make you feel better, because sometimes when you're dehydrated, your head hurts. So it's so important to think about what your body needs and nurturing it. It's like, taking good care of your body, because then it'll translate into your mentally feeling better, not just emotionally, but even cognitively. You're going to feel like you can focus better, you'll have more energy, you can attend to what you're doing better. Maybe your productivity will increase because you're feeling sharper, your memory is better. So it's so important to make sure your body is well taken care of. And
Yeah.
I'd like to add one more thing to that, which is, starting your day in terms of coping with stress, starting your day on your own terms, meaning that very oftentimes, we start our day very passively and kind of just drift through the day. But if you spend a minute or two in the morning thinking about, okay, how do I want my day to go? And starting your day with purpose and saying, okay, this is my plan, not just in terms of a to-do list, but also in terms of, this is what I want to get out of my day. This is what I want to accomplish for my day. So you're consciously setting the tone for your day rather than sort of drifting to the day. And part of that is going back to the issue of social media. Like if you start your day with looking at social media or checking the news, now if there's something bad going on there, like if there's some bad news out there that just broke, that can set the tone for your day, meaning you go through the day feeling weighed on, and feeling kind of upset about what happened in the news, or maybe you saw something in social media that made you unhappy, or something in your social network that you're not thrilled about, and you carry that with you through the day. And this may seem subtle, but it can play out, because now you've let the outside world determine how your day is going rather than you decide how the day is going. So my suggestion would be, not that you shouldn't look at social media and the news, certainly do that, but don't start your day with that.
Yeah.
I would say kind of do that later in the day, once you've gotten the day off to a good start and you have momentum. And then, of course, later in the day when you're taking a break, check your news and check social media and all of that. But start your day on your terms.
Yeah.
I really like that. And I think it's so important to like set your intentions and rhythms and recognize that things like social media can disrupt that. I mean, I never really thought about how like looking at my phone can like disrupt my day. But now that I think about it, I feel like definitely looking at social media like right before class starts makes me a little bit distracted in a
Yeah.
way. And I feel like that maybe makes me more inclined to like want to check my phone during class. And I definitely see, now that I think about it, a difference between not checking my phone before school and then checking it before school, and like my concentration levels and I guess my motivation too. And I think that's a really good point that you made.
And I know it's hard to change. These are habits. We all have habits, and we're creatures of habit because we're all products of learning. So once these habits are formed, all of what I'm suggesting here is hard to, like, if you have a certain sleep routine or sleep habits or eating habits, it's hard to just sort of pick up and say, okay, I'm going to change this overnight, because it's not easy. But I think if you make a conscious effort, and just remember this, your brain takes about 4 to 6 weeks to form a new habit. So if you're trying to make a change, just be persistent and put in place sort of a system where you can motivate yourself, encourage yourself, set up reminders around you to do what you're trying to implement in terms of forming a new habit, so that then once you've crossed that 6 week 2 month mark, you're golden, because then it becomes a new habit, and you'll your body will thank you for it, your mind will thank you for it. But it is going to be hard in the beginning, because breaking old habits and implementing new ones are not easy. But just be consistent for the first few weeks, and then it gets easier.
Yeah. I think that's a really good idea.
I agree. And I think everything that you talked about are definitely things that I'm going to try to implement, especially the decreasing my caffeine intake is like really something I need to work on.
How much caffeine are you drinking, Mega?
A little too much, I think.
Yeah, just a little bit, small
Yeah.
goals. Like I said, set small goals for yourself, like just a little bit, and see if it makes a difference. Think of it as an experiment and see how your body feels and see how your
Yeah.
mind feels
Yeah.
with less. In the beginning, it may be hard because you may have some caffeine withdrawal. It's amazing how dependent we get on caffeine.
Yeah.
But again, give it a couple weeks and you'll feel very different.
Yeah.
I think that is everything we wanted to touch on. Thank you so much, Dr. Nayak, for taking the time out of your busy schedule to come speak with us. We really appreciate it.
It is my pleasure, and thank you so much for doing this. This was great. It was fun.
Thank you. That's all for today's episode. As always, if anybody has any suggestions, make sure to leave a comment down below. Thanks, everyone.
Thank you. Bye.
Bye.